Hello friends, let's today talk about L5-S1 disc prolapse or slip disc. L5-S1 disc is the lowermost disc in our spine. Lumbar spine in the lower back is the area which takes maximum load of human body. And the last disc in this spinal column is known as L5-S1 disc. Now first of all, let us understand what is this disc. This disc is like a cushion between the bones. Between two hard bones, there is a cushion filled with jelly. It is like a tire of a car. It is round. It has a thick outer covering known as the annulus fibrosus, and it has a softer inner core filled with jelly known as nucleus pulposus. So what are the common reasons for slip disc? Normally, slip disc is because of factors like overweight or cigarette smoking, or if somebody is not exercising regularly, or if somebody sits in a poor posture like working on a sofa or bed while working on laptop, or sometimes because of injuries also, like if you get a fall from a height, or if there is repeated bending movement or lifting heavy weight in gym, like while doing deadlift exercise. So all these things can damage your disc, and when that happens at L5-S1 level, it can be very catastrophic. So if there is a disc problem at L5-S1, there are two types of symptoms. If there is no compression on the nerve, then patient will get only back pain. However, if the disc material has come out and is pressing the nerve, then patient can get pain radiating down the leg, which is known as sciatica pain. It can be a severe current-like pain traveling down your leg. Sometimes this can also lead to numbness or tingling in your leg. So if you get numbness or tingling in your leg, that means there is a pressure on the nerve. Sometimes there could be frank paralysis or weakness in some part of the leg, also known as foot drop, when the patient is not able to lift the ankle up. It is known as foot drop. Sometimes if there is pressure on the nerves related to motion or urine, then the patient may have problem in passing urine, or he may not be able to pass motion at all. So if these symptoms are there, don't worry, meet your doctor first. First of all, your doctor will do a clinical examination, and based on that he will advise you to get an MRI done, and the MRI will clearly point out that there is a problem at L5-S1 level. Good news is not everybody requires a surgery for this. 97% of the patients can be treated with medicines, exercises, physiotherapy and rest. So normally that is how we start. We ask the patient to be on rest for few days, start physiotherapy, give him medicines like painkillers, anti-inflammatory or nerve medicines, and slowly we ask the patient to get back to his life. We ask the patient to quit smoking, to exercise regularly, lose excessive body weight, and sit in a good posture whenever he or she is working. Now in the remaining 3% of cases, sometimes we may require a surgery. So there are three indications for surgery. First is if the pain is not going away with medicines, physiotherapy and exercises. Second is if there is any weakness or numbness in the leg. Or third, if there is loss of motion or urine control known as cauda equina syndrome. In such situations, we require to do a surgery. And normally these days we do surgery by minimally invasive technique only. Minimally invasive technique involves microscopic or endoscopic surgery, which is done through a very small skin incision, and without cutting any muscle, without cutting any bone, we slowly remove the part of disc that has come out and was pressing the nerve. This is a very successful surgery, and 6 hours after the surgery we can send the patient home also. Normally, patient is allowed to stand and walk on the same day. He can walk, go back his home. Also, he is allowed to climb stairs. And benefit of this surgery is rehabilitation is very fast. Within few days, the patient can return back to office also. So if you are suffering from L5-S1 disc prolapse, don't worry. Visit your doctor, and based on the findings of your MRI and your clinical examination, he will suggest you appropriate treatment. Thank you.